Deciding what occupation to pursue can be a difficult task for many young people today. There is a vast range of occupational areas available in today's workforce. The healthcare industry is one of the most stable and fastest growing career fields in the U.S. Some people won't consider healthcare as a viable career option because they don't like the sight of blood or needles. Although many jobs in healthcare deal with these things, not all of them do. In the following scenario, we'll learn about some of the healthcare professionals who work in the medical field. Warren Bankston, age 62 years, has just been in a car accident. The extent of his injuries is still unknown, so it is important for paramedics to get him to a hospital as soon as possible. As soon as Warren arrives at Ochsner Medical Center, several medical professionals get to work on him right away. A registered nurse will first assess the patient's condition.
As registered nurses, when somebody like Warren first comes to the emergency room, we're able to assess his airway, breathing, and circulation, which were intact. From there, we focused on his broken leg, which was splinted by the paramedics en route from the scene to the hospital. And from there, his leg was stable upon reception to the emergency department.
In order to test for internal injuries, Warren's blood is drawn by a phlebotomist.
After I collect the blood and I process it properly, I know that it's on the way, and once the blood work is complete, now it takes a step in a direction towards making someone feeling better, because now the doctor can judge what kind of medications or whatever it is that they need to do on the patient.
The phlebotomist delivers the blood samples through a pneumatic tube system, which is received by a medical technologist for analysis in the laboratory.
We took Warren's sample and we ran a blood count to see how many red cells he actually lost internally or externally, which would tell us whether or not he needed a unit of blood from our blood bank.
While the medical technologist continues to analyze the blood, Warren is taken to radiology to find out if he has any broken bones.
Warren came in from a car accident and the doctor suspected he had a broken leg. So they ordered x-rays of his tib fib, which is his lower leg, and I did 2 x-rays of his lower leg to make sure that it was broken or not.
The x-ray reveals that Warren has a broken tibia, but the break is clean and does not require surgery. In the meantime, Warren will need medication to treat his pain. A hospital pharmacist will review a list of Warren's present medications and allergies to ensure that the medication prescribed by the doctor is safe for him to take.
There is a pretty interesting difference between your pharmacist that works in the hospital versus your pharmacist that works at the local pharmacy in your neighborhood. In the hospital, your pharmacists are pretty much dealing with the acute issue at hand, and they're also involved in the decision-making of what prescriptions the patient actually leaves the hospital with.
Although Warren's time at the hospital is over, he will continue to be treated by medical professionals on an outpatient basis. After several weeks of healing, he will regularly visit a physical therapist to ensure that he regains full use of his broken leg.
Today in physical therapy, I worked with Warren on strengthening, flexibility, balance, and those are all things that are very commonly worked on in physical therapy. I get great satisfaction every day out of seeing patients come back into the clinic, make progress, feel better about themselves, and do the things that they're able to do to make themselves get around the home better.
After completing physical therapy, Warren Bankston experiences a full recovery thanks to the hard work and expertise of a wide range of medical professionals. Healthcare is a great industry to enter as the demand for medical careers continues to grow. These careers are not only challenging, but also very rewarding because of the direct impact they have on patients' lives.
And I think the patients are getting what they come for, which is good quality nursing care, physician care, ancillary staff care. They get it all here.
I've been truly impressed with Ochsner as an organization and truly impressed with its ability to continue to reinvent itself.
I enjoy seeing a full schedule of patients. I enjoy seeing the patients. I enjoy making people better.
It's a teaching hospital, so I always find myself learning something, and the nurses on my unit are always willing to teach me something or, tell me something new.
Everyone I meet has been so nice that I feel I've stepped into a medical paradise.
I'm happiest when I'm here. The crew is like a family to me.
We hope that one day you'll consider joining Ochsner's team on our mission to serve, heal, lead, educate, and innovate. If you're interested in exploring a career in healthcare, Ochsner offers job shadowing, a career camp, and a science program to help educate you, our future healthcare professionals. For more information on these programs and more, visit our website at ochsner.org.